Hello there. I'm hoping that you'll recognize me as Sherlock Holmes and think about, what do I have in common with the students of our simulations? Welcome back to my silly analogy. I'm Paul Phrampus, the director of WISER, the Winter Institute for Simulation Education and Research at the University of Pittsburgh. And I want to make this comparison to Sherlock Holmes to the students of our simulations because I think it has important implications to our scenario design process. When you think about it, there's a hypervigilance amongst our students. I've got to look for clues during this simulation so that I can figure out what they want me to do. And it's a lot like the process Sherlock Holmes goes through when he is investigating a crime. This has important implications for our scenario design work because many times we get confused with the idea that we're trying to recreate reality and that's what simulation is, when in fact it is not that at all. Our job as the simulation experts is to create a milieu that is sufficient enough to allow a student to progress through various aspects of the provision of healthcare so that we can kind of make a judgment and say, hey, they need some work in this area, and hey, they're doing really good in this area. And to be able to do that, we put up facsimiles of what they will experience in the real clinical environment, in the simulated environment, to help them adjust their mindset, to help them progress down the pathway of being able to take care of those patients. So we have to be very, very mindful that during the simulated environment, people put on their best Sherlock Holmes. They are, as a popular song goes, looking for clues at the scene of the crime. Now, let me talk about this in a more practical way. If I'm working in the emergency department, and I walk into the room and I see a knife sitting on the tray table next to a patient who is in that room, I immediately think, wow, somebody didn't clean this room up after the last patient and there's a knife on the tray. Fast forward, put me into a simulation. I walk in the room, I see the knife on the tray next to the patient's bed. And I immediately think, I'm probably going to crike or do some sort of procedure on this patient. That's what this is all about. Okay. Now, how does that translate to our scenario design work? We need to be mindful that the students of our simulations are always hypervigilant. They are always looking for these clues. So sometimes when we have things that are included in the simulation, we might just have them there as some window dressing or to create some reality. They can be misinterpreted as necessary to be incorporated into the simulation by the student for success. And then all of a sudden, the student sees this thing sitting on the table. So they think that it is very important for them to use it in the simulation, and they're using it in the simulation, and the simulation is going off the tracks. And as the instructor, you're saying, what happened? This is not what was supposed to happen whatsoever. We have to be able to objectively go back and look at the scenario design process and recognize maybe, just maybe, something we did in the design of the scenario, which includes the setup of the environment that the simulation takes place in or so on, that misled it. In particular, if we see multiple students making the same mistakes, we have to go back and analyze our scenario design. I like to call it noise. When we put extra things into the simulation scenario design, it's noise. And the potential for that noise to blow up, drive the simulation off the tracks, goes up exponentially with every component that we include into the space where the simulation takes place. So be mindful of this. Be mindful of the hypervigilance associated with students undergoing simulation. We can negate some of these things by good orientation, by good practice with our simulation scenario design so that we're only including items in the room that are germane to accomplishing the learning objectives. Orientation to say what's off limits, those kinds of things will help. But most importantly, when you're testing out new scenarios, if you see the same mistakes happening again and again, please introspect, go back, look at the design of your simulation scenario and think, could there be a flaw in there? Because I guarantee you there is. And you know who finds the flaws? Sherlock Holmes. And the ability to interpret the clues that are found at the scene of the crime. So think about it. When you're designing your scenarios, align with some best practices. Try to eliminate the confusion that comes from the hypervigilance of simulation. Until next time, happy simulating.